Asymptomatic man infects 14 medics with coronavirus. They are calling him Chow Ji-Chu and Boze, super spreader. He took more than 15 days to start feeling symptoms, even though he was able to infect the doctors and nurses. In the 25th of December 2019, Zhao, 69, was admitted to the Union Hospital of Huazhong University of Science and Technology in Wuhan. He was suffering from pituitary tumors. He didn't have a very good cardiac function, coronary heart disease, sinus bradycardia and other illnesses. He stayed in the hospitals for 12 days for pre-operative examination and evaluation until January 6th. Before the brain surgery, he had no respiratory symptoms, normal body temperature, normal white blood cell and lymphocyte values. Pre-operative x-rays showed he had some shadows on his left ribcage due to a long history of smoking. He was full of gas, good mental state. The doctors didn't have any reason to doubt he had an sort of viral pneumonia. December 30th, 2019, the hospital received an internal notice about cases of pneumonia of unknown causes, and January 7th, 2020, the hospital staff started wearing protection clothes. Zhao's surgery was done January 8th during the morning. It was done successfully, and the patient was in stable conditions. January 9th, the hospital was informed that the unknown cause of pneumonia was a virus called coronavirus. But Zhao didn't have any symptom whatsoever. January 11th, Zhao suddenly got fever, but it was extremely difficult to determine the clinical reason. Since he made an cranial surgery, it could be changes in the body's stress, cerebral vascular irritation, changes in intracranial pressure. Meanwhile, a neurosurgeon issued a lung cord scan. Image display showed multiple lung opacities sheet with right pleural effusion, interstitial pneumonia. Significant pulmonary infection performance has emerged. Also, leukocytes increased significantly, elevated neutrophils, lymphocytes low. These changes are not typical virus infection. Doctor immediately reported the case and specialists did RNA tests confirming the patient got the virus and infected 14 people from the hospital staff. He was classified as super spreader. That's when a person infects a large amount of people. The hospital doesn't know how many people were infected by the patient and the staff, since hundreds of patients, medics, and students go to that hospital daily, and as observed, the infected person might take 15 days to feel symptoms, but can infect others even before the symptoms appear. Source: China Press. Imagine how many more are like him. We are only hearing this because he was in hospital care for pre-existing conditions, therefore it could be fully documented. I have been very skeptical of the panic engulfing the internet these past few days, but this post truly terrifies me. Guys, for real, should we be worried? Someone be 100% with me. I'm a second year biology student focused in neuroscience. I in no way, shape or form specialize in immunology and disease vectors or anything of the sort. My take? This is going to be very, very bad. Reasons? 1. China lied/lying about original outbreak. This is the most important part. They lied, which allowed the virus to reach out further to asymptomatic period. Biggest factor here. Too many people can be infected with having no idea for too long of a period of time. Basically, it's a bomb with a 2-week timer, and that person spreads bombs during 2 weeks with no clue. To continue the analogy, you now have a mass terrorism issue as a large portion of the population is actively exploding, dying, becoming very ill, and actively making other people spread and explode. 3. The misinformation of death/China's response. Videos we see cannot be verified, but China's citizens risk a lot by uploading anything remotely bad. I highly doubt there's a large volume of people who speak Chinese clearly with Wuhan dialect taking time to stage multiple fake videos in real facilities. Basically, I think every single person on this planet is at risk of this affecting their area. Stay healthy, drink vitamin C. People on this sub are being delusional with their masks and goggles, and probably just raise their risk of infection by constantly having to put hands near their face. Let me put it this way, were there to be a global pandemic that kills thousands to 1 million plus people, this is how it would look at this stage. Now, of every disease outbreak like this, how many would get that big? IDK. In terms of fatality rate, total cases, incubation time and transmission rate, everything points to really bad, and as we're reliant on China for official numbers, there's a possibility this is much more worse. More cases, more fatalities, higher fatality rate, higher transmission rate. But at this point it appears you've reached a critical mass of cases, with a strong suggestion quarantines were largely ineffective in China and cases have gone international. So you have people busy airports, big cities, walking around with a highly transmissible virus without showing symptoms for a whole 2 weeks. That's really bad news. Maybe it's overly cautious, but if I were elderly, or were immunocompromised, or had a respiratory disease, and in the US I'd probably be vigilant, not go outside, or wear an N100 mask, especially until it's clear there's a handle on total cases and it's not exploding upwards. There's a strong desire not to look stupid, but given the dormancy period, by the time there's a substantial number of confirmed cases, the number of infected will be astronomical. I'm tough so I'm not as concerned, but if new information develops suggesting someone in my city is infected, I'll probably take significant precautions. I worked in an immunology lab for 4 years. I have a chemical and biomolecular engineering background and work as a process engineer on a clinical phase immunotherapy drug. FDA new drug application submitted, so soon commercial phase. One of my closest professors was a virologist too, so I have good working knowledge of immune response to viruses. That being said, to be clear, I don't have an epidemiology background. This is going to be very bad, as others noted, but there's something super important to realize. I'm assuming you live in a developed country in the Western world. We have different social customs than most of Asia, particularly when it comes to hygiene and personal space. I don't mean that as a knock on any culture, it is just a fact. Europeans and Americans just don't stand on top of each other in the subway or in mobs at ticket counters like they do in China. We also spit a lot less and wash our hands a lot more. These cultural differences all add up to different infectivity profiles in different regions, and ours will almost certainly be lower than theirs. In addition, on average, our hospitals are better equipped to treat critical patients. Wuhan is a very big city though, and I'm sure they have some fantastic academic setting hospitals with top-line care as well, though. But clearly they are overburdened to the point of being ineffective. See first point about rate of spread. The big question is how much lower will infectivity be in developed Western countries? If significantly lower, we'll be okay. If not, we will have massive problems. I live in the USA and I stocked up on masks and canned food today. FWIW. Better safe than sorry. I live downtown in a major city though. I've run multiple test scenarios through Plague Incorporated. They all come back the same. 600 million people dead. But Japan did lead the way with the cure. I'm a physician, and though I haven't done clinical work, meaning work with patients, for some years, I still work in legal cases. The bad things about this virus are: 1. No early information by Chinese authorities. They allowed it to spread. 2. Novel virus, so we, the world, didn't know how it worked. 3. Rho is 3 to 5, meaning one person will infect 3 to 5 of every 10 people he or she comes in contact with. This is according to early studies. The value of the R0 may be found to be different later as more cases are included in the statistical analysis. This is higher than SARS, which has R0 of 2.8. 4. Mortality reports R3, 10% of the severely ill. We still don't know what percentage become severely ill. Remember, we have only seen lethal cases in China. Mortality depends not only on how bad the virus is, but also on the quality of healthcare, overall population health, availability of resources and previous knowledge about the disease. Large amount of patients with an unknown disease, novel, face a higher mortality. SARS mortality has become lower with time, as we have learned about it. Ebola patients in Africa had a much higher mortality than those treated outside Africa, because healthcare and resources were poor or scarce and pre-infection health of patients was bad. For instance, bad nutrition, etc. 5. Long period of incubation, up to 14 days. 6. Transmission of the disease is possible during the incubation period, meaning before symptoms happen, allowing seemingly healthy infected people to spread the disease. 7. The 21st century allows movement of massive amounts of people fast around the globe, which means that in less than 24 hours large amounts of people with the virus, and no symptoms at all, can find their way to another country. Soldiers traveling from Europe to the Americas, returning from war, are thought to have been a major factor in spreading the influenza virus that caused the 1918 Spanish flu pandemic. The only good thing about the virus is, it's not airborne, it's spread by droplets, which is slower than airborne transmission. Okay, it's bad, but it's not as bad. Is it an apocalyptic event like in the movies? Contagion, virus, etc. We don't have enough information to know for sure, and that's terrible, but it's lethal and easily spread enough to be of concern. What I think is that regardless of the pandemic definition by the WHO, maybe it's time to call it a global issue, be more aggressive in keeping the sick away from the healthy population. Examples: quarantine, travel restrictions, etc. and providing the zone with ill people with resources and personnel to take care of sick people and take care of the healthy ones until the problem is solved. It's called containment. Just in case, I have goggles, masks, and gloves, and of course lots of soap, in case it hits my area. And if it comes to my area, I will buy tons of non-perishable food, and try to go out as little as possible. Luckily, there are no direct flights from Asia arriving anywhere close to me. With experts from said fields weighing in on the topic of the virus, it's easy to see the different dynamics that exist in the severity of the disease. What one could say for now: avoid sick people if you can, and make sure to practice proper hygiene. If you enjoyed the video and want to see more Reddit news, please consider liking, commenting, subscribing, or pinching my ears. Have a beautiful day.